guys, this is Dr. Herb. Today we'll look at the 2021 and this is going to be the NACO guidelines. So the NACO guidelines on the PEP as a post-exposure prophylaxis, this is going to be for the HIV. So first is we look at the exposure code. So the exposure code is 1. So in case of exposure code 1, the HIV source code is also going to be 1. So is there a PEP recommendation? So in case of PEP recommendation, it is not required. Next is we look at the exposure code 1 and the HIV source code is going to be 2 and the PEP recommendation is going to be yes, it is recommended. Next we are going to see exposure code 2 and the HIV source is going to be 1 and the PEP recommendation, it is recommended. Then is the exposure code 2. Here the HIV source code is 2. So in such cases again it is recommended. Then when we look at 3 and the HIV source being half, here it is again recommended. Lastly, when you look at the code 2-3 and the HIV source being not known. So HIV source, it is not known. So in such cases the PEP recommendation will be, it is to consider the PEP. So we consider the PEP and if the HIV prevalence is high in the given population. HIV prevalence is high in the given population. So now let's look at the exposure codes. So when you look at the exposure code, there is something known as the EC1. So EC1 refers to the mild exposure. So what is meant by this mild exposure? So the mucous membrane, the non-intact skin with small volumes, the eyes or the mucous membrane or subcutaneous injections following the small bore needles. So it is a mucous membrane. Then comes the non-intact skin. So there is non-intact skin, mucous membrane, non-intact skin, and this is going to be with small volumes, non-intact skin with small volumes, and also the eyes or the mucous membrane or the subcutaneous injections and this is following the small bore needles. This is following small bore needles. Next is we move on to EC2. So what is this EC2? So in case of EC2, there is a moderate exposure. So the mucous membrane or the intact skin. So the mucous membrane or the intact skin. So this is with a large volume or this is with a large volume. This is with large volume or there is percutaneous superficial. There is percutaneous superficial exposure and this is going to be with a solid needle. So previously it was a small bore needle, so it's going to be the solid needle. Next is the EC3. So EC3 means there is severe exposure. So severe exposure, there is a percutaneous, and there is a large volume. There is going to be a large volume and this is by a hollow needle and a deep puncture. There is going to be hollow needle and the deep puncture. Next we'll move on to the HIV source code. So what is the HIV source code? So here in HIV source code, the SC1, there is SC1 HIV positive. H1 HIV positive, it is asymptomatic. And the CD count if you see, it is going to be high and there is a low viral load. So in case of SC2, there is going to be again HIV positive and it is symptomatic. The CD count will be low and the viral load will be high. So it is completely opposite in case of SC2. So HIV is positive, but it is asymptomatic. Here it is symptomatic, CD count is going to be low and high viral load. Next is SC. In case of SC is unknown. So here the HIV status is unknown. HIV status, it remains unknown. Next we look at the recommended PEP regimens. So what happens in case of recommended PEP regimen? So in terms of recommended PEP regimens, there is the adolescents and the adults. So it includes the adolescent and the adults. So what do you mean by this? That is greater than 10 years of age and greater than 30 kg weight. So it includes the tenofovir 300 mg. Next is the lamivudine, that is 300 mg. So tenofovir 300 mg, lamivudine 300 mg, as well as the dolutegravir. This is going to be 50 mg. Next is we look at children. Next is children. In case of children, there is greater than 6 years of age. There is greater than 6 years of age and greater than 20 kg weight. So this will include, there is zidovudine. It includes zidovudine, that is the dosage as per the weight band. So there is dosage as per the weight band. Next comes, there is lamivudine, that is the dosage is again based on the weight band, along with the dolutegravir. So here it is going to be 50 mg. So children is greater than 6 years of age and greater than 20 kg weight. We have zidovudine, lamivudine and the dolutegravir. It is going to be 50 mg. So what we need to know is that the PEP must be initiated ideally within 2 hours. So it is given within 2 hours ideally, and certainly within 72 hours, and certainly it is given within the 72 hours. So what is the duration of the PEP? The duration of PEP is going to be 28 days or 4 weeks. So this was all about the 2021 NACO guidelines for the PEP for HIV. To learn and grow daily like this, please do subscribe.